Great to welcome back to the North American Microphones Live. Dr. Fahmi Farah is on with us, and one of North America's best when it comes to cardiology. And, Doctor, always great to have you on board to talk about wellness. Welcome back.
It's great to be back.
Thank you. Appreciate you joining me on the show. And, hey, let's talk a little bit about you and what you do. You're based in the Dallas-Fort Worth area, and you do a lot of great stuff. Welcome back. Tell folks about you.
Oh, thank you so much, Willis. Yeah, I am an invasive cardiologist, and I'm also the CEO and medical director of Bentley Heart Medical Center here in Fort Worth. I see all sorts of heart patients, starting from heart attack to chest pain, heart failure, rhythm problems, you name it, I do it. And also, I am the director of Global Health Lines Foundation. So we work on multiple different platforms there, including women empowerment. So a lot of great things on that platform.
Oh, absolutely. That's a great starting point about empowering women, empowering people with knowledge about what they need to do. Is that a multi-platform approach? Say maybe digital, up online, podcasting, websites, that kind of a thing?
It is. It has. We provide a lot of different things, like global education. Like for instance, during the pandemic, we worked very closely with India and UK, providing education to providers across the world. Actually, we provide lectures and things like that. A lot of talks on women empowerment and things like that. I also have a podcast. It's called Queen of Hearts Podcast. It's actually on a lot of different types of heart health topics. Women empowerment is one of the key topics on it as well. And my new episode is actually coming out. It is on women in medicine and in training.
Okay, absolutely. And the podcast, that's available through the Apple store, the Google Play store?
It's currently on my website, drfahmifarah.com, as well as YouTube, and it's coming soon to all the other channels like platforms like Spotify and Apple.
Outstanding, and so glad you mentioned that because so many of the drivers are looking for medical information to be able to use to help guide them through the path of life, if you will, and that's what it's really all about. Earlier, Doctor, I'll set this up for you, that we were talking with someone about the cold weather going on in the state of Colorado. As an example, some folks in like Colorado Springs this morning had 30 below wind chill. I can't even imagine that. 30? Can you imagine 30 below with the wind chill, or 40 below? And the question that I came up with is that, well, if you're going through that kind of cold weather, which many folks are doing right now in some parts of the United States, incredible. Am I correct in that? Does it put a lot of stress up on the heart when it's that cold?
Oh, you absolutely are correct on that. I mean, that's like unimaginably cold for someone like me who's talking from Texas. And hypothermia is something we do worry about during this time of the year, especially in regions where it's that cold. Hypothermia can be very dangerous. It's a condition where when you're exposed to the cold, your core body temperature drops below 95. And when that happens, a lot of bad things can happen, like it can cause damage to your internal organs, specifically the heart. It actually can slow down the heart to a point where it can stop and people can go into cardiac arrest. So I do think that's a very dangerous thing, and people need to be very cautious of that during this time of the year.
Okay, absolutely. Now, many of the truck drivers that are listening have to get out of that truck in this bitterly cold weather 5, 6, 7 times a day. They may be working locally or regionally. Discuss the importance of having multiple layers of clothing on to, I guess, keep the body heat closer to the body itself. Does that help with regulation of the heart when you can keep the heat inside?
It does, yes. You need to keep yourself warm, and layering up, as you mentioned, is very important to keep yourself warm. And also the duration of exposure outside. When it's that cold, you do need to be cautious of how long you're outside in that cold.
Okay, and take that a little bit further, because say that somebody extends themselves and is not able to be able to get back into a warmer area. and it creates pressure on the heart. Can the heart maybe experience like permanent damage when it gets that cold if it's not treated?
It depends, and it's going to be individualized for somebody who already has pre-existing heart condition or somebody who has a lot of risk factors like, high blood pressure, cholesterol, diabetes. They're going to be more susceptible, and also the elderly or the younger, like children, they're going to be more susceptible to getting damage early, like faster, so to speak. It's not going to take much for their heart to take a toll. So I do suggest for all people to be cautious, but especially those those people in that category, they need to be more cautious.
All right. And how would you treat that, say, in an emergency room, that somebody's coming in, maybe experiencing hypothermia, that they're just cold to the touch? What would you do as far as treating that? Would it maybe have to stabilize the heart rate first and go from there? How would that be treated in the ER?
Yeah, it's going to be depending on, what condition the patient comes in, but typically speaking for hypothermia, when they come to the emergency department, the first thing is to warm them up. We sometimes use warm saline that we inject IV. That's, of course, not advisable to anybody doing it at home. You definitely need to go to the emergency department and seek professional care. We also, as you mentioned, like depending on what part of the body got affected by it, particularly if it's the heart, typically heart rate goes down, and as we warm the patient up, like that kind of improves. But as you mentioned earlier, like the damage that it could do, somebody could have a heart attack as a result of that strain and stress that severely cold weather can place on their heart. So, of course, we'd be treating them for that underlying condition. If it is a heart attack, that's an emergency. We would take them to the cath lab, do an angiogram, and see if there's a blockage that we can fix. We, of course, fix that. So it's going to be individualized care based on what part of the body took a toll.
And when a lot of folks have heard this term, heart attack, Dr. Farah, and it's used in the media quite a bit on TV. But what exactly is a heart attack? What happens to the heart?
So heart attack is an acute thing. It typically happens most commonly as a result of a blockage that's already there. So blockages typically take a long time to form. That's a gradual thing. And the higher the percentage of the blockage in a coronary artery, the higher the chance of a heart attack happening. So specifically heart attack, when we're talking, like, when a blockage forms, typically it's a stable blockage, meaning the content inside, which is typically like, cholesterol buildup and things like that, it's encapsulated by a layer within the coronary artery. But when a heart attack happens, that layer ruptures, so to speak, and all the content within that blockage abruptly comes out, and it clogs up the entire artery. It becomes like 100% blockage. And there are different categories of heart attacks. A massive heart attack is when it's 100% blocked. And so the content that's coming out is blocking it 100%, and that's a massive heart attack. So that's the definition of a heart attack right there.
All right, absolutely. And it's important for the drivers, the trucking industry, to know this, because if you are experiencing things like chest pain, may not be indigestion. If you're feeling like maybe you've got maybe tingling on the left arm, drivers, you got to get into an ER to get some help out there. And doctor, when you're mentioning the blockage here in the arteries, I'm just thinking, could that maybe lead to an aneurysm of the heart? Is that one and the same or something different?
It's something different. Aneurysm is also something that should not be ignored, and they can present similarly to a blockage. The most common and typical symptom of a blockage is chest pain, and aneurysm can also develop as a chest pain. Like, there's presenting symptoms and signs can be chest pain. So what is an aneurysm? Aneurysm is basically the wall of the artery ballooning out. It's dilating and ballooning out. So it's different. It's very different from a blockage. In fact, when it balloons out enough, if it dilates enough, kind of like a balloon, it can burst at one point. And that's when the aneurysm becomes very dangerous because it can just bleed out and that patient can die from that. So aneurysm,
wow.
it is a different thing, but it's very dangerous as well.
Okay, absolutely. And this is why it is so important for folks, if they've got something like this going on, to make sure that they form that collaborative partnership with their cardiologist. And so important to do that. Doctor, let's do this. I've got a break for some commercials, and I'm going to put you on hold. And ladies and gentlemen, Dr. Fahmi Farah is on with us, and one of the best cardiologists in North America. You know, everything is going to center around the center of your chest, and that's your heart. You know, it's part of what you got to do out there and stay on top of all of that. You drive, many of you, up to 11 hours a day. You've got that 14-hour duty cycle under the Federal Motor Carrier Safety Administration rules. But you got to take care of yourself. I mean, do you experience chest pains quite often? Do you have, like, maybe some numbness maybe running down the side of your arm? We'll talk about some of those warning signs. And what about belly fat? I want to talk about that. Belly fat, if you've got, maybe a little overhang on that belt. You know, you see it and you know it's there, but can that also be an indication that, you know, you might run into maybe some heart issues later on? Great to have on board Dr. Fahmi Farah, one of the best cardiologists in North America. On with you live now, drivers, answering a medical-related question you've got. Not here to diagnose you over the phone. Got to make mention there, but she's here to give you information you can use and take it back to your own provider. Doctor, thank you very much, as always. Very much appreciate what you're doing for the hundreds and hundreds of thousands of people listening to this. And, yep, that's verified, and I appreciate you jumping in. You know, I mentioned this prior to the break, that everybody on the planet, some way, shape, or form, might have a little bit of the that belly overhang that goes over that belt loop, over the top of the pants. Is that maybe an indication that if you've got that going on, maybe there's, say, some excess belly fat there, could that be a warning sign that maybe you could be susceptible to heart issues later on?
It is, Willis. That excess belly fat that you're talking about, that's called central obesity. And that is a very good sign that you probably have internal organ damage going on, particularly the heart. Those people who have, like, you know, the ratio of central obesity, like the circumference of their abdomen is higher, they tend to have a higher risk of having coronary artery disease, which is blockage in your heart. And as a result, your risk of having a heart attack and stroke are much higher.
Okay, absolutely. And from there, I would imagine once that is determined, that maybe a regimen of eating properly, maybe trying to get some exercise might help to alleviate that. Correct in that? Talking with the doctor and getting on that path.
Yes, eating healthy and exercise are so important in prevention, not just for those who already have coronary artery disease, because it'll certainly slow down that process, but also for young people, you know, people who don't have any coronary artery disease. I recommend everybody to start early. The earlier you start with healthy eating, the better your heart condition will be.
Okay, absolutely. And speaking of young people, are you seeing more and more younger people, Dr. Farah, coming in with heart issues, heart concerns, maybe, I guess, in their 20s, early 30s, that kind of a thing?
We are. I'm so glad you brought this up. I actually did a couple of interviews this week on this topic. The recent data is showing that the rate of heart attack has increased by a lot in the young group between the age of 25 to 41. This is a very young age group that we used to ignore actually when it came to heart disease, but that's no longer the case. Over the course of the last 10 years, we've been seeing an incremental increase of 2% every year in the rate of a heart attack in this age group. And one other study that was recently done that showed a 40% increase in the rate of heart attack in this age group.
My goodness. Is there a genetic component to heart disease, cardiac issues, things like that? DNA play a part?
Hereditary, yes. The genetics definitely plays a role for those who have family history of heart disease or sudden cardiac death. They should get their heart checked early on. So, yes, genetics plays a huge role in all types of cardiovascular disease.
Okay, absolutely. And again, drivers, I know many of you are driving for long periods of time, and you're in that seated position. You got to get out of that truck, but sitting for, say, 10 or 11 hours a day really can take a big toll on your body. That's why you got to get out. You got to stretch, and I think more trucking companies are becoming very much aware of the importance of maybe shortening up those runs. Where you are maybe out of that truck a little bit more, where you can walk around and you can keep that circulation going. Doctor, I've got about 2 minutes left. Is one major risk warning sign for possible heart issues, maybe the swelling around the ankles? That a big issue right there?
It can be. Swelling in your ankles and legs is a sign of congestive heart failure. So if you're experiencing that, you definitely need to talk to your doctor and get that checked.
Okay, very good. Doctor, thank you very much. I really appreciate you joining me on the program to talk about this very important subject matter for the drivers that are out there. And again, many are in the 40, 50-year age group. And again, that sedentary lifestyle, driving 11 hours a day, up to 11 hours a day, and that 14-hour work cycle really can take its toll. Before I let you go, Doctor, one more time, where can folks find you on the web? Where can I go?
You can find me at www.drfahmifarah.com, also on social media, Instagram and Twitter at Fahmi J. Farah.